Good morning, Megan. Patients are sometimes curious to know why their doctor chose the specialty that he or she did. I chose ophthalmology when I was a resident at Parkland Hospital in Dallas, Texas. I did a rotation through ophthalmology, and one afternoon in the clinic, a very kind chief resident sat me down at this machine here called a slit lamp. And he provided me with a patient to look at. And he said, "Okay, Harris, look through the slit lamp and look at the vein right at the edge of the limbus, which is where the cornea and the sclera come together." And he said, "Do you see that, Harris?" I said, "Yes, sir, I do." He said, "Okay, now keep that in focus." So he turns up the power. And he said, "You still see that in focus?" "Yes, sir." He said, "Okay, I'm going to turn up the power again." Turns it up again. He said, "You still see that?" I said, "Yes, sir, a little harder, but I can see it." And he said, "Okay, one more time and turn up the power." He turns up the power again, and he said, "Now then, look at that vein. And when you look very carefully in that vein, you will see little tiny red dots moving through that vein. Do you know what those are, Harris?" I said, "Red blood cells?" And he said, "Yes, those are red blood cells going through that vein." And I said, "Oh my God, that is so beautiful." And right then I knew I wanted to be an ophthalmologist.